Welcome to the Healthcare Payment and Revenue Integrity South speaker interview series, where I, Lydia Toth, the producer of this upcoming event, will have the pleasure of interviewing some of our esteemed speakers. Today, I'm joined by Jenny Raulerson, the Senior Clinical Consultant at Florida Blue, and Kelly Springmann, who's in charge of Provider Enablement and Product Development, also at Florida Blue. They'll be collaborating with Dr. Ahmad Kalani on the panel discussing the strengthening of pay and provider relationships at our event in February. Hi, both.
Hi,
Hi,
Lydia.
Hi, Lydia.
So I just want to ask you both, first of all, what points you're hoping to highlight during your panel.
Sure. One of the key themes that we are going to focus on is collaboration between payer and provider. We really need to break down the silos that exist between our organizations with open and proactive communication. So during our panel, we're going to talk about some of the real world examples and experiences that we have had collaborating effectively with our provider partners. In addition to that, we'll also be talking about how technology and data can be used to empower and enable business processes to improve the interactions between payers and providers.
Do you have anything to add to that, Jenny?
Sure, Lydia, thank you. Coming from a unique perspective of having experience on both the payer and the provider side of the healthcare and bringing valuable insights to the industry, a few main ideas to highlight are the first one would be fostering a collaborative and communicative and transparent approach is crucial for strengthening relationships. But most importantly, number two, gaining that alignment that the member and patient is truly at the center of everything we do or trying to accomplish. And of course, three, data sharing. Collaborative relationships thrive on information that allows for better decision making, and having access to relevant data can lead to more informed decisions, choices, continuity of patient care, and streamlined administrative processes.
That was very interesting. I really look forward to your panel, and I really hope you manage to convey all these points. So for you specifically, Kelly, as someone in charge of the interaction with providers at a major organization like Florida Blue, what has been your main focus when looking to streamline communication with your providers?
Sure. So I partner closely with many other teams within our network division and throughout our organization who work with providers on a daily basis, so that our team can have a holistic view of what the provider experience is like. In our area, we implement a lot of changes and enhancements to provider-facing tools and capabilities. And so when we're communicating with providers about those enhancements and changes, it's important to ensure that we express the value that the provider will realize by using that new capability and how it will improve their experience with our organization.
Thank you, Kelly. And now for you specifically, Jenny, as someone with experience on both the pay and provider side, as you said, what is the main point you hope to highlight to payers about the interaction with providers?
Sure. One of the key points I hope to emphasize to payers regarding their interaction with providers is that importance of fostering collaborative, communicative, and trusting relationship. Trust promotes effective collaboration between the payer and provider, and that is essential for delivering high quality, cost effective care to our patients. Having that clear and open communication and mutual understanding of each other's objectives, constraints, and priorities can significantly improve patient care and administrative processes that drives value from both perspectives. I've had the actual pleasure of witnessing our organization through our provider liaisons who work closely with those providers to develop long-lasting, meaningful relationships that deliver value to the communities we serve and our enterprises.
I really hope you managed to convey this point. So finally, I want to ask you both what you're most looking forward to at this upcoming Healthcare Payment Revenue Integrity South event.
Sure. I am excited that the event will include both payers and providers. It's always great to get the opportunity to step outside of our bubble and interact with other payer and provider communities to understand what they're all working on and prioritizing for this year.
And what about you, Jenny?
Sure. Personally, I'm excited about several aspects of this conference, especially hearing from keynote speakers and thought leaders in the healthcare industry. It can be incredibly inspiring. Their perspectives often shed light on new directions for healthcare innovation and policy.
I really hope that you both managed to get as much experience out of this conference as possible. Well, thank you very much for sharing your insights, both of you. And I really look forward to finally meeting you in person in Miami. Bye. See you there.
Thanks,
Thank you.
Lydia.
Bye-bye.